Hi, everyone. Thank you so much for joining our podcast, Survivors of the War, today.
Host Cesar Salas.
And my name is Caitlin Lopez. I am your co host, and thank you for tuning in to our second episode. Unfortunately, our second co host, Andrea Ramos, is unable to make it for this episode today, but she will be in our next episode that's coming up in the future. And we're so excited today to introduce our guest for today, Nurse Lauren Bryant, who's going to be discussing some information regarding pediatric cancer as well as her experience. So, Nurse Lauren Bryant, we're so excited to have you today. Take it away. Yeah.
Hi, everybody. I am Nurse Lauren. I have been a pediatric hematology oncology nurse for 15 years, and I'm sure I've taken care of both of you.
Yes, you have.
Absolutely. So I just want to put out there that these are my thoughts, and my thoughts and opinions are my own and not necessarily those of my employer.
So Nurse Lauren, what inspired you to pursue a career in nursing, specifically in pediatric oncology?
Yeah, that's a great question. I knew I wanted to be a nurse when I took anatomy in high school. We watched this documentary called Becoming a Doctor from like Harvard, and I loved watching them take care of people, but I kind of always had an eye for the nurses. I felt like the medicine side of things was just a lot more school. I wanted to get in and get my hands dirty, and I wanted to take care of people. More importantly, I've always connected with kids, and it was either going to be teaching, and once I discovered nursing, I knew that was the direction I wanted to go. The oncology side of things, um not 100% sure what landed me in pediatric oncology, besides just I love the bald kids in the St. Jude's commercial, and I just really wanted to take care of them. I really wanted to give them a hug. I really wanted to get the opportunity to make kids like that feel better. So that's what I wanted in nursing school. It's what I went to nursing school for, and I've been blessed to be able to make a career out of it for 15 years.
A long time now. Now that I think about it, like you really had like 2 years when I was diagnosed then.
Yeah, I was still a baby. That's still in my nursing world. That's baby nursing.
Yeah.
But yes, we learn a lot real fast, and we're all pretty darn good at what we do because we have such a passion for it.
Can you share a bit about your role and your day-to-day responsibilities as a pediatric oncology nurse?
Yeah, of course. I'm kind of after all these years, I have multiple hats that I wear. But my day to day is showing up at 7. I'm there for 12 hours. We get report, we find out what's going on with our patients and what they need for the day. We're constantly talking with doctors. We're kind of like a middleman of sorts, and our job is to manage the care in that day. So tests and scans mixed in with physical therapy, mixed in with the chemotherapy needs. It's kind of where the people to air traffic control, if you will, and keep our patients safe, dressing changes, managing nausea, helping patients get to and from the bathroom, chest tubes, you name it. There's a plethora of things, and with nursing, no day, no 2 days are ever the same. So there's a wide variety of things to do in all of that. Sometimes I get to train new nurses, which is a huge passion of mine. As I've gotten further in my career, I've really enjoyed helping other nurses become great nurses. So I often train our new nurses. I get to do charge nursing too, which if the nurses are the air traffic controls for the patients, the charge nurse is really the air traffic control for the unit that day, admissions and discharges, and helping out the nurses where we can. So lots of different things, and lots of different things to do as a nurse.
My next question would be just to kind of follow up with that. What are some of the biggest challenges you see in children and families that face during treatment?
One of the biggest challenges that patients and families face during treatment, it's the shock. It's the adapting to a new normal.
Mhm.
Um, when we're dealing, in the adult world, there's times when you can identify patterns and behaviors that adults do,
Yeah.
or people with more years in life do, that can lead to cancer.
Mhm.
And for kids, it really comes out of the blue. A lot of the times, we don't talk about pediatric cancer. You guys do. It's your world. It's my world. So 100% of the people in my world talk about pediatric cancer. Very few, from a general population standpoint, really think about it. And they often will tell us, like, I didn't know that kids could get cancer. And so that level of shock and trauma, um, and having to learn how to navigate a new normal is pretty challenging. And I mean, to state the obvious, and this is a survivor's path podcast, and I don't want to bring down the energy, but then when we have to navigate when treatment doesn't go the way that we all wanted to, hope and pray that it does, work so hard to do the research to make sure it goes that way. It's devastating. I think even more so in the last couple of years as I've navigated becoming a mother. Those are probably the two biggest challenges: the shock of the diagnosis, having to navigate a new normal, and then when we run out of options.
Yeah. No, I definitely relate to like the shock of factor of it because I know when I got diagnosed, I know that, for me it was just I was just a little bit confused. I was like, wait, like, I'm barely 12 because I got diagnosed when I was 12 and I was thinking at that time, I said, wait, I'm only 12 years old, like, I don't think I could ever get cancer. And a lot of like my family members and even like friends that I made after um after I finished like my surgery and my therapy, it was really hard for them to like kind of like accept that, okay, this actually has really happened to like a friend of mine and stuff. Like I didn't really think that, that this would happen. It really became really eye-opening that, that even if there's like a percentage that said, hey, there's only like this much percentage that this would happen to somebody or a 1 in a million chance that uh, that someone could be diagnosed with like cancer, it doesn't really hit you until like, like a really close friend of yours
Mhm.
diagnosed versus how would I say this? Versus like just hearing about it and like the news or online.
It really takes that close impact sometimes, and with pediatric cancer it's all the time. It's that having somebody close to you go through it, any age really. With cancer just sucks. Let's just put that out there. Cancer sucks. It doesn't matter how old you are and you're navigating it. It is interesting to watch child development theories and stuff that I know like unfold in front of me. As sad as it is to think of like a baby or a 2 year old or a 4 year old navigating cancer, those kids, they just want to play. So they're bebopping all over the hospital. They don't really think twice. If they feel bad, they feel bad. But if they are like feeling great, they just want to play. My teenage population, man, over the years, has that been the one that it really hurts, touches really deep, because there's a greater awareness of what you're going to be missing out on. There's a greater awareness of certain side effects. And maybe you can attest to this, but as a person who values my hair and having to navigate hair loss, would it's just that the teenagers in the realm of challenges, my heart hurts, fights the hardest and hurts the hardest watching our teenagers navigate cancer.
So, how do you approach supporting children emotionally when they are scared or in pain?
I bring my whole heart. If it depends on the age. If it's a little kid, it might be getting down on their level and looking in their eyes and letting them feel how much I plan to be there for them and take care of them. A lot of times it's supporting the parents. If the kids see us supporting their parents, they feel more supported. And some patients, it's super important to give as much detail as possible. That's in rope our multidisciplinary team, get child life involved if need be. It's just kind of getting to know your patient, and meeting their needs, not just what I can provide. It's what do you my patients need from me. And I hope that just, with some kids, it's identifying Disney stuff. With the little kids, it's singing Frozen with them. With the older ones, I can't tell you how many hours I've spent in a room total talking about Harry Potter, Star Wars, the Marvel universe, because those are my nerdy passions. So, yeah, I think just bringing who I am and getting on whatever level my patient needs me to be on to feel supported that
I
day.
was 10 months at the hospital, and to be honest, it didn't feel like it was like that long. And so after
You
I
had
got,
fun with us?
yeah, like so I got out, and I was like, wait, like I was almost like a whole year at the hospital.
I mean, I will say that the majority of his colleagues, our goal would be that like you don't realize you're in the hospital, if possible. If there are moments that we can provide that. We had one patient that would come in and out, and at one point she was telling her mom she was coming to have slumber parties at the hospital with her friends. So yeah, if we can bring that energy and make it feel like a party or a slumber party, like then we're doing what we set out to do. What like my biggest goal at the end of the day would be that every kid feels like they're coming in and having a party with us.
Me, when I got diagnosed when I was 12, I know there is a group of friends that I had when and I'm still friends with some of them today, that would come and visit me, I think almost every Friday, ever since I mean, I think it was before school was out. I think after they found out I got diagnosed, yeah, a few of them or even all of them would come and visit me like every Friday. Like my dad would drive them like from like the middle school, like they would all carpool going over to the hospital just to say hi to me. And it was just really nice because with allowing that atmosphere to happen, just it opened up a little bit of like normalcy for me, without having to think about, okay, I have to go through therapy, okay, I have to like make sure that like the tube is working in my mouth, or on my nose and stuff. And just by allowing that, like that little bit of normalcy, like for my friends to be able to visit me, because I know like I know like how some hospitals, they have restrictions on like who they can allow to have visit in the hospital, if it has to be like um a close family or just like one or two friends. But it opened up that path for normalcy to me, and just like kind of gave me that sense of being that, hey, you can still live a normal life even though like you're still like in therapy, you're still like inpatient. So that's what I really liked the most, that I was still able to have that little bit of normalcy, even though I was still undergoing like therapy, and making sure that I was still getting better.
Yeah, that's it. Physical health, mental health, like they're really like joy and sadness. You can't you kind of have to work with both of them, and we're gonna navigate, hopefully try to take care of you on both levels.
For like me, I would just get a random like visitors. So like one time, I remember like after surgery I couldn't see, so I had two of my elementary teachers go visit me, and they brought a bunch of like
Yeah.
board games and stuff. And then once they showed up, my mom said they made a face like, "Oh wait, how's he gonna play, boy, if he can't see?" Like, so they kind of felt bad when they seen me like I couldn't see and stuff. So
Mhm.
they're like, "Oh my god, we feel so bad. We buy you all these games, but you can't play them right now."
Yeah.
But lucky after my I got my vision back, and I could actually use the game and stuff.
Yeah. And then yeah. I mean, it's also really challenging to know, I think, what you guys need. And so I think doing something like this is awesome to be able to put a voice to helping I mean anybody who's watching it, really, family members, friends, how to support people going through what you guys have navigated. So the value in what you guys are doing is just incredible.
And so, with that, being able to approach supporting children that are like scared or in pain, how do you balance being emotionally present for your patients while you're also protecting your own mental health? Like you're going through so many emotions, seeing like a lot of these families, they're scared, they don't know like what the future is gonna hold for like their child or like their family. How do you balance that emotions and your mental health at the same time while still caring for the patient, the children, sorry.
That is such an empathetic question, and I'm blown away, and I'm not sure that I've been asked it that way. Um, to be honest, I'm still learning. And it's our job is ever changing. So there's an element of that, society is ever changing. So there's an element of navigating that. And then me myself over years have changed, and things that I didn't find as challenging, and managing my mental health have become a lot more challenging. There's a lot of trauma over 15 years.
Mhm.
Um, of navigating new diagnosis over and over and over and over again, navigating bad news over and over and over again. Sometimes it's for the same patient, and in 15 years, I might see a patient over and over and over again.
Mm.
Um, I do what anybody else does and finds what works for me. I run. Running has been my therapy for 12 years, I think. About 3 years into my career, I started really running long distances. And I feel like I can pound out my grief on the pavement. Um, my drive home from work is an opportunity to think, decompress. Sometimes I'll drive home silently.
Yeah.
Sometimes it's just classical music. Um, but anything, I try anything at therapy. I have absolutely leaned into talking to a psychologist just because it is heavy. It is not, it's kids, it's cancer. And then now as a mom, I'm having even a harder time. So I cry when I've had to discharge patients on hospice. I'm absolutely a wreck, as many of us are on the unit. So yeah, I feel them. How about that? There's a lot of emotions, and there's a lot to feel. And years I might stuff them, like younger nurse might have stuffed them, and more experienced nurse kind of says, "Hey, this is happening. You're feeling this. This is hard. This is sad. This kid is the same age as your kid. That's even harder now." So yeah, I think it's just acknowledging it and trying all the things. All the things. I do them all.
Yeah, it's really good to hear it from your perspective because, I mean, me and Caesar as like a cancer patient, we don't really, I mean, Caesar was the one that actually came up with this question. Because, just thinking about it, I mean, as a cancer patient, we're so focused on, okay, like, we're stressed out. We're also thinking about like how our families and friends are stressed out also as well. But like, it doesn't really hit us until like later once we get a better understanding of like what pediatric cancer is and like there's different types. Like it kind of like brings up that, okay, like, how are the nurses and how are the doctors feeling on their end, having to hear that like all of these families are going through like all of these obstacles and on top of that they have to deal with their child going through cancer and like their treatment, how is the nurse reacting to it on like their end, their emotions. So it's really good to just listen and just hear like from your perspective like how you feel like having to handle like all of these families and the patients. So yeah, it's a really good insight just to see on like the other way versus like the patient and family side. So yeah.
If I could get anything across, it would be to every family and patient going through this. You don't just like stumble into pediatric oncology as a medical professional, whether or not it's our child life specialists, our doctors, the nurses, our respiratory therapists, our physical therapists. You're well aware of what you're going to navigate, and it's a choice because we really care, and we really really want to take care of our patients and our families, and we're willing to take that cross, if you will. I'm a spiritual person, not necessarily a religious person, but I will say that the vast majority of us feel like we've been called into this, and we're there to help with suffering and however that looks, and we really, really, really want to be there to take care of our patients. There might, everybody has a bad day. I know that I listen, I know that I'm always not this bright, sunshine, cheery nurse. And not every nurse is going to have the best day. So everybody's got their story, everybody's got their experience, but every single nurse I work with on my unit is the creme de la creme, and they really care and want to be there. I'm not going to lie, it's heavy, and it's gotten heavier over the years.
How how has working with children and families impact your personnel personally and professionally?
I'm a better person all around for my experience. I grew up in Rancho Cucamonga. It's a beautiful little city. It was always been a little on the smaller side, growing in the recent years. But I don't feel like I had a lot of exposure to diversity from socioeconomic status, from ethnicity status, from all of the things. And working in the city, and my patient population, cancer does not discriminate. In case you were wondering, age doesn't matter. Gender doesn't matter. Sexual orientation does not matter. What color you are on the outside does not matter to cancer. What language you speak doesn't matter to cancer. So the exposure of all that culture has made me such a better person. And all the different challenges have made me a better nurse. So I am better 1,000% for my career choice and for my choice of employment and my choice of profession. So I'm a better person because of what I do for a living. That's how I feel. I mean, maybe that sounds bad. I don't know, but I definitely feel like I'm a better person because of what I do.
Okay. And then also what keeps you motivated in this field in such a demanding and at the same time it has like the emotional aspects of it. What keeps you going? What keeps you motivated in doing your job?
I think it always goes back to your why, but that why has changed so much over 15 years. When I was a baby nurse, it was just to learn how to be the best possible nurse I can be. And that's still part of my why, but my why has expanded into being a role model for all the nurses coming in and being the best possible version of myself to be a role model. Um, the the why sometimes, listen, my career is flexible. I work 3 days a week for 12 hours. Yes, 12 hours seems long, but I have 4 days off. So sometimes my why is that I have flexibility in my schedule, and that's what works for my life. And that keeps me motivated at different times. Teaching, I love to teach, and I teach new nurses. I teach at nursing schools, and so that has been my why in my profession because sometimes I do feel like I need to step away from pediatric cancer and think of just general peds. And hey, kids just get tonsillectomy sometimes, and sometimes a lump is really just a fluid collection, I promise.
Yeah.
So yeah, the why changes. And it's all good. And I don't have a solid steady besides just wanting to continue to be the best nurse that I can be.
I'm hoping nurses and like doctors see this podcast. So another question I have, like, so if right now there's a nurse thinking like, oh, which path should I go? Like, if they're picking between oncology or another, like, what do you think will be like? I guess like a pro or like a. Well, what would you tell them to like so they could decide going to oncology or like?
Um, I think you gotta love kids and all ages. When you're thinking of pediatric oncology, I don't know how to say it other way besides you have to be okay with suffering. And I'm not just talking about suffering from like end of life type perspective. I'm talking about like just administering chemotherapy, knowing that I'm going to watch my patients in bed be nauseous, feel like crap, lose their hair, be susceptible to infection. Um, you have to be prepared to be able to sit and hold space for the suffering that you're witnessing because you have to assess it thoroughly in order to treat it. So you have to be prepared to navigate suffering. You have to be prepared to navigate loss. um, Again, real moment here would be that we do lose patients, and as the nurse it is my job to walk with the family um, as they navigate the steps. Sometimes it's describing what they're seeing and what's happening from a medical standpoint. Sometimes it's just being in the room and holding somebody's hand, holding the patient's hand with the family. So you will inevitably, as a pediatric oncology professional, experience death and dying. So being prepared for that and it not being you got to know whether or not you can handle it, I guess, is something I would tell somebody considering pediatric oncology. Like, are you prepared for this inevitability, and are you prepared to sit and help somebody suffering?
Yeah.
Is there anything else you want to talk about, Nurse Lauren?
I feel like, I mean, we kind of chatted. I feel like we hit that we care a whole lot. I mean, at the end of the day, we're people too. You guys helped me discuss an emotional side of what I do, and so I first of all, thank you for the space and the opportunity to say some of these things, uh, because I think we don't we get them stuffed up, and I don't think we get to do that very often with you with former patients more than anything. I mean, and would be we would be remiss if we didn't mention the reason why we're all together is because of Pavlov.
Yeah.
And that's something that I love to be able to do between the Beads of Courage program and the Paw Love Foundation. These are two organizations that I absolutely, any chance I get, refer a family to, because I think that the power of Paw Love itself and the photography and the expression that it allows for our patients, and clearly you guys know. But can't not mention Pavlov and the Shutterbugs. I think I have a picture right behind me.
I'm actually glad you said that because that's gonna be our next podcast. So if whoever's watching it, we're gonna be talking about Pablo next.
That's awesome. I can't wait to listen in on that one. That's fun.
Thank you so much, Nurse Lauren, for joining us today. This has been it's been a great pleasure to have you on our second podcast. And my name is Caitlin, and
I'm Cesar Salas, your host.
yes, and thank you for joining us for Survivors with the Roar. To be sure to be followed up with our upcoming episodes, please sure to be updated on our Instagram page at survivors underscore with underscore a underscore roar, and then also on TikTok and YouTube at Survivors with the Roar. It's been a great second episode joining in with everyone, and we'll see you all on the next one. Bye.
Bye.